Afternoon, everyone. I'm just going to have a couple of minutes waiting for people to join us for this live session. Okay, so I'll just give a little bit of time for people to join us, and then I will make a start. I see some people coming in. Okay, so welcome as a couple of others join in. So I'll just give another minute, and then I will make a start. Afternoon. Okay, as I said, I'll just wait a little bit longer, just give it another minute, and then I will make a start. Give people an opportunity to join. Okay. So how I'm sort of kind of going to do this afternoon session is I've just got a couple of slides I'm going to read through, which is an overview really of the Dental Academy, what we're about, what our teaching style is, and then a little bit of the courses that we do. And then obviously I'll open the floor to questions, and we can do some questions and answers. Okay, so welcome. I'm Tracy Wallis. I am Associate Head Students at the University of Portsmouth Dental Academy. I therefore lead on admissions, and I'm also a Senior Teaching Fellow. So I teach across all the programmes as well at the Academy. The Academy, we have 4 programmes. One is a short course, which is called the Dental Development Programme. And that course is for qualified dental nurses or dental technicians who maybe qualified a number of years ago, maybe haven't been studying for very long, don't have what we call the educational tariff in place, and don't have any what we call level 3 science in place or access course in place. And they can apply to do the dental development program, and it's a short course to really put that level 3 science and academic tariff in place to go on and apply for the dental hygiene or the dental therapy courses that we have. And part of that criteria is that you do need to have registration with the General Dental Council, be a qualified dental nurse or a qualified dental technician, but all details are on our website of all the courses that we have. We also have the Cert HE, which is a Certificate in Higher Education of Dental Nursing. That is a 1-year program. So within an academic year, you qualify and can register with the General Dental Council as a dental nurse and work across all areas of dentistry within the UK. We then have a 3-year BSc programme in dental hygiene only. It is the first of its kind in the UK to offer BSc in hygiene. Most hygiene courses across the country you'll find are diploma based. And as I said, that's a 3-year programme, and at the end you will be able to go onto the GDC register as a dental hygienist. And then we also have our 3-year dental hygiene and dental therapy programme, and that's a dual professional programme. So you will be able to qualify and register as a dental hygienist and as a dental therapist. And we call that our dental hygiene and dental therapy. And the two roles are very, very different. So we do look in our candidates for an understanding of both the roles, because they're very different once you've graduated and you go on the register and carry out those roles. Okay. Sorry, I just missed a. So the academy, it's quite unusual, really. Again, it's quite unique that we offer what we call a primary care dental service to NHS patients, and because we have that NHS contract and we treat NHS patients as if it was a general dental practice, we have a very large, varied staff base. We have an academic team, so that's who are going to do all your teaching and your learning. They're all registered dental professionals. They're all on the GDC register. Some of them are full-time academics, while others work in clinical jobs outside, and they come into the academy in addition to those roles and teach on our clinical floors and do the clinical teaching and supervision as part of their role as well. We have staff nurses, and these are registered dental nurses, and they provide clinical and mentoring support to all the students whilst they're undertaking patient care in the clinical environment. And now, as well as our UOP students, or University of Portsmouth students, we have King's College London 5th year dental students. So as part of an outreach programme, we have the 5th year King's College dental students come in. We have a patient administration team. They support all the patients and students in the organisation of appointments and communications. And also we have a technical team, because we have a lot of clinical equipment and chairs and operational bits that need to happen. So we have a very large staff base, and we are quite different compared to some courses that universities run, in that we have that NHS contract. We also, a little bit different to some dental schools that you may find, is we have an integrated team-based approach to learning. So we have our University of Portsmouth students and we have the King's College London, and you actually all learn together and work together as part of the dental team as you would in general practice. So you will have clinical learning opportunities to all work together in your roles, replicating real life practice. And additionally to that, some of our University of Portsmouth students, you will study the same modules. So you'll find hygiene, nursing and therapy students will all study the same module together. And then there'll be some modules that you'll study in just your cohort of the profession and the course that you're going to be doing. And then additionally to that, we do what we call multi-professional teaching, and you will also do some modules with the School of Healthcare Professions and study alongside paramedics, operating department practitioners and general nurses. And you also get opportunities to partake in what we have community oral health programs. We have a brush up program in the local schools. We go into residential homes. We do work with the elderly and the homeless. Currently, that work's on hold due to the COVID regulations and the pandemic. But hopefully, if things get back to some form of normality, there will be opportunities to carry on and do that community work. Teaching delivery is very varied. Everybody learns in a different style. So we actually do a mixture of lectures, seminars, workshops in large groups, in small groups. We have what we call preclinical simulated work in our skills lab and our phantom heads labs. We also do simulated work on the clinics, and then we have live clinical sessions where you'll be treating the patients that we have. So you will actually treat live patients on the dental nursing and the hygiene course. You will do that in your first year. And then for the hygiene therapy, it will be in your second year. So for hygiene therapists, your first year is predominantly in phantom head and the simulated environment. We also expect a lot of what we call independent learning. That's supported by our Moodle platform. And the interaction with Moodle is a very, very key element for engagement, really, and for your learning. And in the kind of current climate where we've been doing lots of the blended approach, where we've got some face-to-face and some online live, we've really, really relied on that platform for your teaching. You will also find that UPDA, which is what we call the University of Portsmouth Dental Academy, you are more heavily timetabled than other courses, that you have like a half of theory and half of practical, and you have to get all that content. So you need all that underpinning theory to then actually apply that theory into the clinical practice. And so therefore you're kind of timetabled really Monday to Friday. So it's quite a heavy timetable in comparison to other courses. And we also carry out formative assessment quite frequently, and that supports your learning, it supports your progression, and we can sort of see where you're at and how your learnings go. So even though people can go, oh, your assessment, formative assessment is very, very good, like what we call for learning and for your progression. We've got excellent student support within the school. You will have a named personal tutor. They are there for your welfare. They're your point of call for any questions or problems or anything that's going on that you think, oh, I need to be speaking to somebody, contact your personal tutor. You have a mixture of one-to-one sessions with that tutor and a mixture of group sessions throughout the year. But then the wider university's got lots of designated services to offer support with academic skills, with disabilities and learning, with technology, and with health and well-being. You'll find the university is very, very good at student support. Our NSS, so our National Student Survey results, are annually very, very good. Last year's data gave us an overall, as a school, an overall satisfaction of 90%. The teaching on my course is 94%. And the question, have I had the right opportunities to work with other students as part of my course, was 100%. So I think as a department, we're functioning quite well. Students are quite happy with the service we provide. And really, that's kind of the end of my overview, and I will go over to any questions that anybody might have. Okay, so first question. What I'll do is I'll read the questions out as they come in, so then obviously everybody can benefit from them. So how many people do you have on the dental therapy course and dental hygiene course? We have roughly anything between 25 to 30 students. We tend to recruit 25 annually, but then we also have international students, and we also have maybe some students have happened to repeat the year, and so that's why we may go up to the 30 mark, but our recruitment tends to be 25 places. Okay, any other questions coming through? Okay, how is the course assessed? Okay, so a little bit when I mentioned the different teaching styles, we also do many different assessment styles as well. So, and we're trying to, so what we're trying to do is get this person who is not within a professional body, we're trying to get you from novice to safe beginner in a profession and be a professional. So we do a mixture of written exams, online exams, individual presentations, group presentations, you have vivas, you have case studies, you have clinical portfolios, clinical logbooks. And so what we're trying to do there is get all the different skills that we need to out of you, get you interacting, get you working as teams. And obviously, again, we kind of acknowledge that just the exam approach isn't the best approach to get outcomes from people and for learning to happen. So we have a breadth of assessment types. We don't just stick to one type. Okay, so and what you have is each year you will study 5 individual modules, and each of those modules has a different form of assessment. So your clinical modules will have a mixture of oral vivas, case studies, and collation of a clinical portfolio that starts from the day you start to the day you finish, of all your clinical progression or your clinical experience. and making sure that you've hit those markers that we want for your learning outcomes to make us happy that you are able to go out and go onto the dental register. Because once you complete the course and you're successful, what that does is it tells the General Dental Council that you've been through a course of study and you're able to go on as a register and practice as either a dental nurse, a hygienist, or a dental therapist. Okay. Anybody, any other questions? There's a few people on, a few questions. Obviously, currently at the moment, our teaching style is a little bit different. Assessment is the same, albeit we're not doing face-to-face, but we're still doing exams that have all gone online. We're still able to do vivas because we can do them on the online environment. And the clinical work is a mixture at the moment of simulation for our students and some patient contact. It's just with the guidance at the moment, all dental practices can't pick up what we call, you'd know, is the dental drill. We can't do any of the drilling that makes all the high-speed noise and squirts all the water, because that's what we call an aerosol generating procedure. And there's a risk of COVID, obviously, because we're working in the mouth and the throat. So we're unable to do those at the moment unless you've got specialised surgeries with air extraction. So we're a little bit limited at what we're doing currently, but hopefully that's going to change in the new year. And we've ordered different kinds of handpieces that we'll be working with that don't do the aerosol generating. And students have got what we call, I think I said it in the overview, we're doing a blended approach. So it's a mixture of online live, like I'm talking to you now. I would have a group of people on a platform such as Zoom, and we can have breakout rooms, or it might be something like Padlet. So it's an interactive timetabled kind of taught session. Then you've got work to do, what we call asynchronously on your own, directed study. And then we're also doing face-to-face, albeit in small groups because of social distancing. We're bringing small groups into the clinical environment and doing a mixture of simulation and patient-led care. Okay, in the interview to enter, what would you look for in a hygienist? Okay, so in our interview process, and we mention all of this on our website, so a good port of call if you're thinking of applying is look at our websites for our courses and click onto all the links that talk about NHS values, NHS constitution, because we don't just look at people's academic ability, we're looking for you as a kind of person. Why do you want to work with people? Why do you want to be in healthcare? Why does dentistry appeal to you? Why do you want to be in the profession? What do you know about the role of a hygienist? What do you know about the role of a dental nurse? So that you understand the role you're going to be doing on graduation, the job you're going to be doing. It's what you want to do. And because all the roles are very, very different. So kind of that's what we're looking for in a hygienist. We're looking at your overall personal values, the understanding of the NHS values, and also that you understand what a hygienist does. Okay, I hope that answers your question. Okay, any other questions coming through? And so when you actually come through, so I'll go back to the interview bit. Before you come for interview, you have to actually put a personal statement in. And I know that lots of colleges have their kind of preconceived ideas about what we're looking for in a personal statement, but we're a little bit different because we're looking for those values. So when you construct your personal statement, we want to know why the profession attracts you. Why do you want to be in there? What do you know about the profession? Have you done any shadowing? Have you done any research around the profession? What do you know about that role? So if you're applying to be a hygiene therapist, what does a therapist do? What does a hygienist do? What does a nurse do? Have I been to see it? What have I researched about it? And then we'll want to see what else you do as a person. Are you in a sports team? Have you got any hobbies? Do you do any volunteering? Do you do any charity work? Have you done any team-based work? You know, have you been on the school council? Have you done things like Duke of Edinburgh Awards? So we're looking for you is what you're like as a person, not just what you've achieved at school, and what you know and why you want to be in the profession. Okay, let's have a look at the questions on here. We've done that one. Okay. There's a question on here. You may, it's Yangzi, do I accept the UK NARIC certificate for the course? I think what you'd have to do is put that through to the admissions team and we'd be able to give you an answer to that one. Okay. So put that through to central admissions, they pop it down to us as a team, and then we'll be able to give an answer to that for you. So how am I helped and supported when I work with patients? So obviously we don't let you live on patients till we know that we've done some kind of threshold formative assessment. So we know that you're able, you're capable, you've done some theory, you've done some preclinical work. So we don't just put you live straight away. And then on the clinic, we have a ratio of 1 to 6, so 1 staff member for 6 students. You will have your own assigned supervisor tutor on that day, and then you'll present your case, you'll see your patient, and bit by bit you'll do that discussion and you'll do the treatment. And that's the support you have on clinic when you're working with patients. And obviously when I talked about the different staff members we have at the beginning, you've also got qualified dental nurses who are also there to help you and support you on the clinical floor. So hopefully that answers the question. So you have a named clinical supervisor, and those supervisors are, again, as I said, we have a mixture of dentists supervising, qualified dental hygienists and dental therapists and dental nurses. Okay, thank you, Josh. My colleague Josh has just replied to Yangzi as well with the email address to put that into the central admissions teams for us to help you with that inquiry. Okay, anybody got any other questions that you want to ask? I don't know if anybody of you have actually already applied. We are currently open for applications. We are doing the reviews at the moment of the personal statements and applications and offering out to interview. And obviously, if that's part of the UCAS system, we'll have a closing date of the 15th of January. All right. Okay, we have actually also, if you're wanting to see the department and know a little bit more about the department, we have virtual open days on the 9th of January. Obviously, due to COVID, again, you know, the buildings are closed. We can't have large amounts of people in one place. And so we had our open days virtually, and that's quite good as well. You get a chance to do another question and answer session with a member of staff. And also you can have a look at photographs and sort of 360 pictures of the facilities that we've got, so some of the clinics and some of the phantom head suites that we've got. So that's well worth attending on the 9th of January, because rather than just see me talking about the department, you'll be able to see some pictures of the department, and you'll also have members of staff live online that you can ask questions to that maybe you've thought about since this session or since you've applied that you might want to ask. Okay. All right, so anybody else got any questions? Okay, don't feel embarrassed, just pop them in and ask. It might be a question that someone else is thinking of. There's the teacher in me coming out. There's never a silly question. Someone's always thinking of the same question. It just takes somebody to be brave enough to ask it. Okay. Okay, really good question there, Matthias. Are there any books we would recommend reading before starting? And you're going to be quite surprised that I'm going to say no. Okay. It's better to wait until you come on the course, because we've got a very, very good library support service. All your modules have in their own reading lists of recommended text. In there, we'll highlight which ones are probably ones you'd go to quite regularly. And there's also a selection. So everybody learns differently, as I've said, and people get different things from different textbooks. So rather than us giving you a list and say, buy all these books before you come, it's better to come to the course, see which ones you're using regularly and suit your style of learning. You might find then that you want to purchase that one, or you may also find that there's enough in the library, and we have a mixture of hardback books and online books. And obviously with the way, because of COVID and the way that teaching and learning is happening at the moment, we've kind of increased our availability of what we call e-learning and online books. So you're heavily supported with text. And so I would probably say just enjoy the time of having no study. And then, because once you start, there will be a lot of reading to do once you start. Okay, I hope that answers your question, Matthias. Anybody, anything else they want to ask? I'm just trying to think if there's anything that I haven't covered that would be useful to you. Hopefully, some of you have applied, or you may apply, and we may see you next September. Okay. Any other questions from anybody? No? Any more? It's been a nice selection of questions, all very good questions that have come through, I think, as well. Hello. Is it Mudasir? Mudasir? Hello? Is there something you'd like to ask? Okay. Can I go to PhD straight after graduation, or do I go into practice? Okay, you can kind of, it's an either or. So when on graduation, as I've said, you'll be able to register and join the General Dental Council Register and practice the role that you've studied for. Or you can also stay on. We have postgraduate courses, so we have master's programs, we have an MRes program, and so you would stay and do an MRes before you do a PhD. So some students do the MRes and then stay on and do PhDs. Some go into practice and then do this part-time, so they work towards masters and PhDs as well as working. They take the part-time routes. Some people stay and they go into the roles like myself and do teaching after they've done a little bit of practice. So there's a number of kind of like graduate routes that you can take. And the good thing about dentistry is it's really quite diverse, and there are so many different elements to dentistry. So it isn't all about just general practice. If you want to do some sort of research, there's hospital-based dentistry, there's private dentistry. You know, now where technology is so good, you can go into implant specialists. You may, if you're in the hygiene route, want to become a specialist in perio. We've also, you know, you've got adult, you've got elderly, you've got children. So all those themselves are specialisms that you may be interested in and want to go in. So, you know, your graduation is definitely just the start of your journey in a career of dentistry. Can I work or study abroad? Okay. Within our courses, we currently don't have many opportunities to study abroad as part of your curriculum. That's nothing to say once you've graduated, you can't go and apply and study, but it's all down because it's what we call a registered professional course. We've got quite strict criteria on what our learning outcomes are that you have to do, and we're inspected and we're accredited by the General Dental Council, so we have to fulfill their criteria. And when it comes to studying abroad, different countries have got different councils that regulate their dental care, and their curriculum for their students that are doing hygiene or hygiene and therapy may be very, very different to ours. And so therefore at the moment, that's why we can't do what we call a study exchange. We are working on opportunities for you to go and maybe have an experience or speak to other hygiene and therapy students in other countries. We have an affiliation with Jean Copping in Sweden. We have an affiliation with Mansipul in India. So you have opportunities to interact, but unfortunately, the opportunities to actually do what we call an exchange and finish part of your curriculum in another country isn't an option at the moment. I hope that answers your question. Okay. What would you recommend if I have done my nursing but wish to be a dental hygienist, or should I do other courses that includes 3 sciences? Okay, so if you mean nursing as in dental nursing rather than general nursing, it will all go down to the tariff. So when you look on the website and look at the entry tariff, you need to have 128 points, and 40 of those need to be in a pure science. So what you'll need to do is make sure that you've got 5 GCSEs in place at grade C or grade 4 and above, including maths, English, and science. So that's your first layer of qualifications you have to have in place. And then you need to have that level science. Now that science can, and that tariff can come from A levels, where you'd be looking really to get an ABB, or it may come from doing an access course. And if you're going to choose to do an access course, you would want one that's got lots of pure science and biology in it. We don't accept we don't accept courses that have what we call healthcare and social sciences in it, because they're very, very different. They're not like the pure sciences. And that's because where you need to understand a lot of physiology and that anatomy of the head, the neck, the whole body, it's a different way of learning, and it's very science based. So we need to know that you're going to be able to cope with that science element, and therefore that's why we look for that you've studied science in some format to some level before we, as part of our entry criteria. I hope that answers your question. Okay, let's see if there's anything else coming in here. Lovely. My colleague Josh, he's put the entry requirement link on the chat. And it is very, very quite comprehensive. If you keep clicking down and opening it up, it tells you what you need for that entry tariff. And if you've done nursing but you don't have the level 3 science in place, that's what the dental development program's for as well. So if you're a qualified dental nurse but you don't have that level 3 science in place, then it may be worth looking at on the website of the dental development program and seeing if that's a route for you. That would be an alternative to doing an access course at college. And if you do the dental development program, we actually reserve 8 spaces on each course for those that are on the dental development program. So if you're accepted on that program, you declare whether you want to progress to hygiene or hygiene and therapy. And if you're successful on the dental development, you then automatically start the following year on the BSc Hydro therapy programs. Thank you, Josh. Josh has put the link for the dental development program up there again. Okay, that's fine. Lovely, thank you. Anybody, any other questions they want to ask? Okay, so just while I was talking about the dental development program there, I did go a little bit of it on my overview, but sort of, as I said, it is for qualified dental nurses or dental technicians who don't have that level 3 science. When I talk about level 3, what I mean there, it's the qualifications that you take after secondary school, so after your GCSEs. So if you're going to be doing A levels, if you haven't done A levels, or you've done them in a different subject area. So maybe you did something like dance and art and photography. You didn't do science. You therefore don't have the science to be able to apply. That's what the dental development's there for. So you've gone on and done a career in dental nursing, but your A levels don't give you that level 3 science tariff. And that's why you'd apply for the dental development program. And then you'd study 4 modules on there. And it's all about anatomy and physiology, body systems, and also academic learning. So we have a little bit about academic writing, referencing, and those academic skills that you will also need in level 4. Okay. And obviously it's a very short course, of dental development program. So it's 23 weeks, 1 day a week for the 23 weeks. And successful completion does give you automatic entry onto either the Hyde or therapy programs. So it's a good access route, I think, for those who are already in the profession, who just don't have that underpinning level 3 science that's preventing them from applying. But likewise, you may choose that you'd like to go on and do the A levels to give you that tariff in place, or you may want to do an access course. If you're unsure about an access course, if you send a message into the central admissions, they always pass that on to us, and we can actually look at your course that you're wanting to do and ask if it's got enough science in it, and we can come back and say yes, that would be a suitable access course, or no, it wouldn't be. So it saves you signing up to a program that you study and do and then find out that actually it isn't accepted for the criteria. So I've had a question up there, is this a year? If it's the dental development program, so the dental development program is shorter than a year. It starts in January. It's for 23 weeks. And then obviously you're assessed. You've got 4 modules and you have to pass all the modules. We don't actually, they're not what we call credit bearing. So you don't build any credit in them. But what it does do is give you automatically entry, like I said, onto the hygiene or therapy. The other course that's a year is our certificate in higher education dental nursing. That is a 1-year academic course. And once you've studied that, you'll be able to sign on with the register and be a practice nursing in the UK. Yes, it's 23 weeks part-time. It's 1 day a week, and it's a mixture of so some days at the moment, next year it's running on a Wednesday. We don't know whether it'll always be a Wednesday, but next year's a Wednesday. So you will come into the department on a Wednesday, and there's 16 people on the course. So we take 8 for hygiene and 8 for therapy. So there'll be 16 people. And then some Wednesdays it will be virtual and online. Other Wednesdays it will be in the academy. And there's no clinical aspect to that. The dental development program is all about the underpinning science and academic study. It's a theoretical program to give you that tariff that's missing to apply. Okay, Mudasa, I think your question there about applied linguistics and the TSOL program, I may have to refer that one to a colleague in the university to answer that one for you at a later date. And also, Yangzi, about working credit. I'm not quite sure what you mean about having to have working credit. So what I'll do is, if we can't answer that today, Yangzi, we'll try and get an answer to that one. Unless you can expand a little bit for me, what you mean by working credit. Okay. Anybody, anything else? Anybody else got anything they want to ask? Okay, thank you. In hygiene, will we go to a local practice and work? No, because we have the NHS contract and we treat patients, all your clinical work is done in-house at the university, and it's what we called in-placement. So some courses use placement and they send their students out to venues to get their clinical experience. But we're fortunate enough that we have our clinical floors and we have an NHS patient contract. So we have patients coming in and you do the treatment for them there. As I said before, there's a couple of opportunities for observations and going out to community work that we do. So there's a little bit of what we call outreach rather than placement. But you wouldn't go to a local practice to work on your hygiene course. All your clinical work would be done at the University of Portsmouth on our clinical floors. And we have 2. So like I said, if you come to one of the open days, whether that be virtual or live, when they start up again, we've got a West clinic, which is predominantly where the hygiene and therapists do their clinical work. And we have the East clinic where the King's College London 5th year dentists carry out their clinical work. Okay. So has anybody got any other questions? I'm just going to sit quietly just for a little while. And if nobody pops a question into the chat box, I will say my goodbyes and say thank you very much for listening. Thank you very much for coming. Thank you very much for answering some questions. And I really look forward to seeing some applications come through. Or if you've already applied, maybe an interview. And hopefully, if some of you are successful, welcoming you in September 2021. Okay. There doesn't seem to be any other questions coming through. So in a minute. Okay, lovely. Thank you very much. Is it Sparkules? I don't know if I've said it right. I look forward to seeing you on your application. I hope you found today useful and a little bit of help towards that application and towards that interview process. Okay, nothing else really coming through on here. Okay, so I'm going to kind of close this down in a minute, but we will be doing more of these question and answer sessions in the new year, both on YouTube and on Facebook. Okay, it may be me or it may be another member of the admissions team or another member of the academic staff from the Dental Academy. Or as you've seen, Josh has put the Learn inquiry email on there quite a lot. If you've got any inquiries at all about the courses, if you just contact that email, if they can't answer it, they pop it through to us in the department and we answer it and get back to you. Okay, so last chance to ask any questions before I end the stream. Okay, I think I will say goodbye. There's nothing is coming through. It's lovely speaking with you all.